You know, can Dr. Scioli walk into a room and it's like, hi, I'm the insurance adjuster. I'm here to conduct the knee examination with you. And is that the burdensome that I think that we're talking about here?
You still wonder, the physician still wonders if he's not going to be second-guessed and maybe sued if what he did wasn't what turned out to have been, I would say, maybe the proper choice or a different choice.
Well, and then, John, you've got many physicians under your stewardship at the Surgery Center. What's that like trying to bring a balance in of, you know, you're trying to watch your costs, and of course these are investors who are wanting to have a viable investment. Sometimes is that a difficult road to steer with that many forces?
Less than you think. Mark makes a good point about being a physician investor, and the thing that people like Pete Stark don't understand is when a physician is an investor, they have a vested interest in the efficiency of the operation as well as the quality. So, to be honest with you, it is, in all my years, I've never been in an environment that was more appropriate in terms of doing a good job in operating a facility. And so it truly is not that challenging because the physicians want it to be successful. You know, their name is on it. They own whatever percentage of it themselves, personally. And they take ownership.
You know, I didn't have coverage for about 2.5 years. I had Mutual of Omaha. They left the state. I tried to get on with other insurance, and basically they said, we'll cover you, but just not for any of the stuff that you have. I had diabetes. I had high blood pressure. My wife one time had told our primary care doctor about some heavy menstrual flow, and they had a rider that said they would cover her, but not for anything that was involving the female reproductive tract. And we had insurance. We got it through the chamber about 1.5 years ago. But I guess one of my issues would be, so if the chamber, which is now the largest collective insurance group in the city of Lubbock, okay, now, if we were all king for a day, and we could go talk down there to the chamber and say, okay, you guys have a little bit of a whip here. We would like you to go out, and here's how you could improve health in Lubbock because you're the money. You've got a collective there that you could go to, Covenant, UMC, North Star, Grace Clinic. What would we tell the chamber what would be a good thing for them to advocate?
Maybe they should be the corporate group to set up a health care for Lubbock.
So even to expand it out and
expand it to the community at large.
That would never happen.
You don't think it's good?
No. They'll never do it. They'll never do it.
You think politically it couldn't happen?
No.
okay, so what could, I mean, again, we're living in fantasy land here for a minute. What could they do in an ideal world that would help? What would you tell them?
Oh, they need to expand their access to any facility willing to provide. And pay them all the same.
Yes.
Absolutely. That's what I would tell them. I'm just saying that won't ever happen. That will not happen in this community. Just won't.
Because of the political forces,
That's
as
right.
John has talked about?
Well, I mean, let's be totally transparent. John sits on the chamber board, and when they talk about those issues, his little facility is not part of the chamber health plan, even though he's on the chamber board. So that should tell you right there. You're wasting your time.
It is. The Chamber Health Plan is an avenue to obviously grow membership and to bring a service to businesses, small businesses that cannot, like you're describing, afford insurance for their employees. Both of those strategies are incredibly admirable. The challenge that the Chamber faces is that the plan being through First Care dictates who is participating. And, you know, it's kind of difficult for me to go too far with that because I do have a responsibility to the Chamber as well, but it's sort of it's a little bit of a situation of being caught in the middle, that's for sure.
Well, let's just call a spade here. It's ridiculous. If they're interested in saving money, improving quality and access for all the citizenry of Lubbock, then there's only one right thing to do. Let the people go where they wish. Abolish the network. It's that simple.
So much like
that right.
So much like in the early days when you practiced medicine, Dad, that people, because it was a cash basis, you said that they could basically, for $5, less than $5, get out of your office, with the idea that if people didn't write the way you did it, they were free to go somewhere else because they weren't locked into your plan.
True.
Do you think that you, as a person now, in your later years, do you have other concerns? I mean, or do you have thoughts about, you've watched Lubbock grow from a small community to being a larger city now. Do we need to, rather than rely on Washington, to guide us into how do we get coverage for people? Do we need to make this a local issue of saying, what can we, the people of Lubbock, do for the people of Lubbock? I mean, if I'm understanding the two of y'all, it's saying...
You are hitting the nail so squarely on the head. And this is an issue that does affect everyone in this community, much different than what you read on the national pundit, blogs and whatnot, have to do with true reform of health care. You can reform all the care you want. You can give everybody in Lubbock the chamber health plan. And they're not going to be able to go to North Star or the Heart Hospital or Grace Hospital or wherever that's off the list. So all of a sudden the public is befuddled. Well, I've got insurance, but they say I have to go over there. What if I don't want to go over there? Sit down and be quiet. That's where you're going. Who made this rule up? Stop the nonsense. So this health care reform is over here. It's over here somewhere. But the reality of misery index is right in your own home, your own hometown, your own doctor's office. And so you just said what needs to be done in Lubbock, America. There has to be a groundswell of people going down to the chamber and beating their brains out on this issue. That's what has to happen.
The word is selfless.
That's right.
So further thoughts. So how could we get awareness? I mean, part of why we're doing this video series is that we want people out there to think about this.
Well, I did realize that the Chamber's program was, as now I've learned, because I thought that it could pertain to anybody and that anybody could be cared for anywhere.
Now, my point to that comment, here's a man who started the program in orthopedics at Texas Tech, was the dean of the medical school, and then the medical director for a national insurance, the regional office. If he doesn't know that insurance plan won't let you go anywhere, Joe Q. Public doesn't stand a snowball's chance in hell of knowing any of this. There you go. Healthcare reform by Nancy Pelosi does not help this issue one iota.
Well, but to take it further, so it sounds like the contention would be the further we move out from our city, it's like understanding that all politics is local. And so if we sit there and we say, maybe the trouble is that for too long we've looked toward other cities, other forces, whether it be Austin or Washington, and maybe the thing is that we need to come together as a community and say, secondarily, we might want to touch base and see what they're doing down south or up in D.C., but this is our problem, and how do we solve it here locally, much like when Dad talked about when he came here and they said, can you help us at the children's clinic, at the sick baby clinic, and this is off the books, and you're not going to get paid, and so when you started it was that way. But is that where we've grown away from? Is because we've gotten so used to saying we need the government tit to make this work, as opposed to how do we as a people do like what we're doing right here, sit down and say, how do we make this work? If everybody came in.
I don't think I don't know too many people that think we need the government to make it work.
Oh, I don't either.
I think you need people that'll stand up and do the right